Most dog owners have heard of arthritis treatments, but very few know about a radioactive injection that can relieve pain for up to a year. Today, we're breaking down exactly what Synovetin is, how it works, and the real risks you need to know before considering it for your pet. Synovetin is not your typical arthritis treatment. Unlike tablets or daily medications, this is a single injection containing a radioactive compound designed to target inflammation inside a dog's joint and provide long-lasting relief. But with that comes serious questions about safety, side effects, and whether it's actually the right choice. Let's break it down properly. What is Synovetin? Synovetin OA is an injectable treatment used specifically for osteoarthritis in dogs. It contains a radioactive isotope called Tin-117 meters, which is bound to microscopic particles. These particles are injected directly into a joint, most commonly the elbow. Once inside, they are taken up by inflammatory cells in the joint lining. What does IT actually do? The goal is simple: reduce inflammation at the source. The radiation emitted by Synovetin travels only a very short distance, just a few millimeters. That means it targets the inflamed tissue without significantly affecting surrounding structures. This process reduces the number of inflammatory cells, which in turn lowers pain, improves mobility, slows progression of joint damage. It's not a cure, but it can significantly improve quality of life. Who makes IT? Synovetin is developed by Exubrion Therapeutics, a veterinary biotechnology company focused on targeted treatments for joint disease. What pets can use IT? Synovetin is currently approved for dogs with confirmed osteoarthritis, typically medium to large breeds. Dogs that have not responded well to standard treatments. What pets should not use IT? It is generally not recommended for cats, not approved. Very small dogs, pregnant or breeding animals, dogs with infections in the joint, dogs with certain immune or blood disorders. A full veterinary assessment is essential before use. How long does it work? One of the main selling points is duration. A single injection can provide relief for several months, in some cases up to 12 months. However, results vary depending on severity of arthritis, joint affected, overall health of the dog. How long does it stay in the body? The radioactive component remains localized in the joint. Most radiation activity decreases significantly over weeks. The particles stay in the joint and continue working locally. Very minimal systemic exposure occurs. Strict post-treatment. Handling guidelines are usually given to owners for a short period. How often can IT be used? This is not a frequent used drug. Typically, it is given once. Repeat treatment may be considered after many months if needed, but repeated use is still being evaluated and must be done cautiously. Side effects and risks. Most reported side effects are mild, including temporary swelling at the injection site, mild discomfort, or limping. However, more serious risks can include joint inflammation flare-ups, infection as with any injection, tissue damage if improperly administered. Because it involves radiation, handling protocols must be followed carefully. Have there been deaths? There is no widely documented pattern of deaths directly caused by Synovetin when used correctly. However, like any medical treatment, complications can occur. Underlying conditions can worsen. Improper use increases risk. This is why it should only ever be administered by trained veterinary professionals. Are side effects permanent? Most side effects are temporary. However, severe complications like infection or joint damage could have lasting effects. Improper injection technique increases long-term risk. Permanent issues are rare but not impossible. What to do if something goes wrong? If your dog shows severe swelling, persistent limping, lethargy, signs of pain worsening, you should contact your vet immediately. Do not wait it out. Early intervention matters. Synovetin is a powerful, targeted treatment, not a miracle cure. For the right dog, it can dramatically improve comfort and mobility, but it comes with trade-offs. It's invasive, it involves radiation, and it requires proper case selection. Always weigh the benefits against the risks and make the decision with a qualified veterinarian.